What's up, team? Let's look at my top 4 training strategies for dealing with low back pain. So let's jump in. Before we jump in full-fledged, I want you to know that this is certainly not the end-all be-all list of things. Low back pain is extremely complex, multifactorial, and there's a lot of ways to get success, get someone out of low back pain and back to training intelligently. So this is certainly not the end-all be-all, but this recipe, this ingredient list of 4 strategies is definitely a helpful way to do it. So number 1 is we want to gain mobility. Specifically, you restore mobility and motion in the spinal column. So we're talking about lumbar, spine, low back, mid-spine or thoracic region for the most part. And then we also want to restore mobility and motion in the hip joint. So flexion, extension, just restoring some of that motion, which will aid in the spine's ability to low back to feel a little better over time. And so I don't care so much to show you guys examples of those things. It's more of you're the coach, you're the author, you are the creative one, but just really restore mobility in the spinal column, specifically lumbar and thoracic or low back and mid back, as well as the hip joint. That's really key. Number 2 is flexibility. So now we're talking about tissues and muscles, not joints. So flexibility, we want to restore flexibility in the hamstrings, the groin or adductor or inner thigh region, as well as the hip flexor or anterior hip musculature. Again, so many different ways to get flexibility in the hammies, the groin, and hip flexors. Again, you guys are the coach, you're the author, so go ahead and tackle that. But that's primary 1 and 2, mobility and flexibility in those regions. Number 3 is stability, okay? Now, this is important because we have to understand that someone's dealing with low back pain. Yes, it's okay to flex, extend, side bend, and rotate the spine. It's totally okay with that. But if we're going to go under load or resistance via dumbbells, kettlebells, barbells, resistance bands, or what have you, we want to make sure that we're providing stability first and foremost to the spinal column. So we can achieve that via the anti-family for core training. Anti-rotation. For example, you could do a Pallof press. So I'm here, I press out, and I'm avoiding the rotation. So I'm just pressing straight out and back, working in anti-rotation for my spinal column and my core and my trunk, really. Number 2 could be anti-side bend. So I'm taking, for example, I could do a suitcase carry. So I'm not letting the kettlebell side bend me. I'm staying tall and upright. I'm walking nice and straight. So this is just a suitcase carry variation. Just a way to get some anti-side bend core strength and stability. The third one is anti-flexion. So I could do something as simple as a goblet carry. And again, these are just examples. There are many examples you could use. So a goblet carry from here, or just a front position carry. I'm not letting the kettlebell flex my spine. I'm staying tall and upright. I'm here doing my thing. And again, this is anti-flexion of the spine for spinal stability. The last one is any sort of anti-extension pattern. So for example, you could do just a regular plank. So you're here. I'm not letting extension happen, so I'm staying here. So this is anti-extension core stability. Again, many different ways to skin the cat for those anti-core stability or trunk stability exercises. That's just to give you a little bit of a starting point. Lastly is the strength piece. Most folks who are dealing with low back pain do much better training through unilateral or single leg or single arm training. So whether that's upper extremity, lower extremity, single leg stuff, whether it's reverse lunge, right? If it's simply a split squat, if it's a 1-arm row, 1-arm press, typically folks do better starting out with their strength training in unilateral or single leg or single arm training because it forces you to use that stability, right? That you've just been building in the third component. Okay, that's really important because it loops in the core. Eventually get your athletes and clients to move back into bilateral upper body and lower body training like push-ups, pull-ups, deadlifts, and squats. And so that's the recipe for 4 training strategies working your way through an athlete dealing with low back pain.